Healthcare analytics is being reshaped by four massive shifts in 2025. Dashboards and endless reports are no longer enough. The analysts who survive now aren't building charts, they're shaping decisions. And if you don't adapt, you're already behind. Shift 1. Power BI and Microsoft Fabric have become the baseline. These tools aren't resume extras anymore, they're requirements. Analysts who don't know them aren't being called back for interviews. Recruiters treat them as the minimum entry point. Shift 2. Cloud fluency is now mandatory. Hospitals and health networks are standardizing on Snowflake, BigQuery, and Azure Health Data Services. Excel-only analysts aren't considered competitive anymore. The organizations that handle thousands of patients daily can't risk slow, manual systems. Shift 3. Predictive AI is starting to creep in. Hospitals are using it to forecast admissions, staffing shortages, and costs. The algorithms work, but adoption is slow. Regulations, compliance concerns, and privacy guardrails make every rollout cautious. Analysts who succeed here are the ones who don't just understand the math, they also understand HIPAA, security, and governance. Shift 4. From reports to narratives. Executives don't want static numbers anymore. They want answers. Which departments are bleeding costs? Which procedures are improving outcomes? Which teams are overstaffed or understaffed? Analysts who can translate numbers into decisions are the ones who get promoted. At one regional hospital, dashboards showed rising readmission rates, but it was the analyst who dug deeper, connecting the data to understaffed post-discharge follow-up calls, who changed the conversation. That analyst wasn't just reporting, they were driving care strategy. At another health system, predictive staffing flagged a shortage weeks before the flu surge hit. Because the analyst understood both the data and the operational reality, the system hired temporary staff early. Costs dropped, outcomes improved, and leadership noticed. In 2025, healthcare analysts are no longer dashboard builders. They're translators, turning raw data into real strategy. The ones who master that shift don't just survive, they shape the future of care. Dashboards are dead. Insights are alive.